The primary surgical approach to restoring the GE junction is a hernia reduction when appropriate, usually a crural tightening as well. And then once that's done, the upper part of the stomach, or fundus, is wrapped around the esophagus, almost like a hot dog in a bun, okay? And that is basically taking a fundus and plicating sort of the GE junction, so it's called a fundoplication. And of course, the physician that sort of described this technique is so therefore called a Nissen fundoplication. It's really a 360-degree wrap, and so it is effective, it is tight, but the issue with a lot of these things is you want tight but not too tight. And the disadvantage sometimes of this is, even though you restore quite a bit of pressure, is that you may have this become a little too tight. And so that can manifest in two primary ways. You'll find it difficult for people to swallow because it's hard to get across from north to south. And you can have the inverse, where you have things that it's hard to get from bottom to top. And you might say, well, wait a minute, isn't that the goal? We want the stomach contents not to come up. But we also, sometimes get intestinal stomach gas that we may want to vent because it's obviously quite uncomfortable to retain that gas. And so a lot of people will have trouble belching or burping, and they will get a sort of sense of bloating. It's called gas bloat. And these symptoms are not infrequent. They can occur 25 to 50% of the time. And as a result of that, many people, even though their reflux gets better, if you do quality of life questionnaires, you'll find that it's not as high as you might expect because they've sort of developed an alternate set of side effects as a result of their treatment.